One of the innovations that IHI is currently working on is how do we take safe care of people at home, because increasingly folks are going to try and deliver care at home. We want them to be able to do that safely. Incidentally, we're also doing the same with telemedicine. Despite the fact that telemedicine is reasonably well established, and it's going to grow rapidly over the next few months and beyond, actually very little is known about the safety of telemedicine. And if we're going to do that, we feel IHI has a role in figuring out how to provide telemedicine to older people and others in the safest possible way. What we're trying to do in our age-friendly health system work, and indeed in pretty much every project that IHI is doing, is pause and pivot wherever we need to. So part of the conversation we were having with the 100 or so teams, what do we need to do to reflect the current reality? Our interventions in that work, we call them the 4 M's, but they start, as so much of our work does, with asking that important question that Maureen and others have promoted about, and Susan Edgman-Levitan helped us to understand the power of, around what matters to you. And so it seems ever more important to start our conversations with patients and family members with that question, not just asking what's the matter, but asking what matters to them. And then we need to have a set of resources to back that up. That's where I think the materials from the Conversation Project can be incredibly helpful to people, and they are freely and readily available on the IHI website.